Now we're moving to if you want to treat acute rheumatic fever. Remember that acute rheumatic fever is kind of like an issue that has to do with inflammation, okay, of the heart muscles, the heart valves, and all of that. So one of the drugs that you employ in its treatment is anti-inflammatory drugs, okay. So for the anti-inflammatory drugs, let's quickly look at the examples of them that are very, very efficient in treating acute rheumatic fever. So this is acute rheumatic fever, okay. So the main anti-inflammatory drugs in treating acute rheumatic fever are basically what? Aspirin, okay, and corticosteroids like Prednisone. Okay, these are the two best ones. So let's quickly talk about the dosings of these drugs and how they work. So anti-inflammatory drugs, of course, you are trying to relieve all those pain, okay, and release heart inflammation. So aspirin is also known as what? Acetylsalicylic acid. Okay, is the first line of treatment for this. You dose it about 80 to 100 milligrams per kilogram per day in children. So it's very effective because it reduces all those inflammation and pain that comes with the inflammation, of course. Monitor for side effects because it can basically cause some gastrointestinal irritation, and it can delay blood clots, right? So it can lead to bleeding. Corticosteroids, this is it. Okay, I did actually bring a picture of Prednisone, but it's a popular drug. It's used when carditis is severe or unresponsive to aspirin. So you bring corticosteroids inside only when it has not responded to aspirin, okay? So it's about 1 to 2 milligrams per kilogram per day. Gradual reduction is necessary to avoid adrenal suppression. So it's a very good anti-inflammatory, okay, and especially when the issue is not involving the heart, okay. So other supportive agents is neuroleptics like haloperidol, okay, colchicine is also still good.